GlobeMed is a student-run nonprofit organization that operates on the notion that every human life has equal value. Each GlobeMed chapter partners with a grassroots health organization abroad to fund their efforts to bring healthcare to communities in need. Washington University's chapter partners with Uganda Development and Health Associates, or UDA, to operate the Iganga Youth Resource Center in Iganga, Uganda, as well as a clinic and nutrition project in the nearby village of Naigobia. The Youth Resource Center empowers youth with information about adolescent sexual and reproductive health and encourages youth to take control of their own sexual and general health. The Naigobia Nutrition Project utilizes a network of community health workers to empower and educate families about how to meet the nutritional needs of their children through food demonstrations, community gardens, and basic health assessments. Here on WashU's campus, we put on major advocacy and fundraising campaigns throughout the year to raise money and awareness for UDA and for the mission of global health equity, with huge successes like our Ugly Holiday Sweater Sale, Social Justice Week, and Article 25 Day campaigns. In addition to these efforts, we hold an annual public health banquet where we invite students to engage and exchange ideas about public health with faculty and community members from around WashU. We also host an annual summit, a 3-day conference for WashU students and GlobeMed members from around the country. This past year, we brought world-renowned physician anthropologist Paul Farmer as our keynote speaker. His lecture drew over 1,000 students, faculty, and community members from around St. Louis and increased GlobeMed's visibility and reach on campus. This year, we've increased our fundraising commitment to $22,000 so that UDA may further implement innovative programs, train more health workers, and educate many more families in need. To reach our new goal, we want to ramp up the scale of our campaigns. So this year, we began planning a gala called Aesthetic. The event will be targeted at WashU students, faculty, and community members, with a special focus on the local art community. Through this event, we hope to engage people who may have never considered an interest in global health and encourage them to join in our mission for global health equity.
Well, the reason as to why I decided to work in public health is like sometimes when you're working with people who you believe in and who make you smile, you always want those smiles to remain intact. So in Africa, in Uganda generally, there are many public health cases that need to be taken care of. And unless a Ugandan raises up their hands and say, I'll take care, no one will. Yes, so the reason as to why, very biggest reason as to why I work in public health is that I love it. It gives me reason to smile.